Welcome back to Elevation Wellness and our presentation today on Ehlers-Danlos syndrome, strengthening and weightlifting. Now we must note as always that this presentation is not meant to be used as a treatment strategy. We want you to consult with your medical practitioner for guidance, your physical therapist, your personal trainer, your athletic trainer for that supervision piece. My name is Thomas Stott. I'm joined by Dr. Patricia Stott, and Dr. Patty and I will be guiding you through this lecture. Let's get into it.
Let's start off with some of the myths that we commonly hear in regards to EDS and strengthening. Weightlifting will harm the joints. You shouldn't do weight-bearing exercises as that can damage the joints. Free weights are bad to use when you have EDS. Machines are bad to use when you have EDS. I'm in too much pain to be able to do any strengthening. I'm too loose to tolerate strengthening. And these are just some of the ones that I've heard in the past 2 months or so. So there's plenty out there that I hear relayed to me, that I see on social media. I'm not sure where these come from. It's definitely not in the science. It's not supported in the clinic. And there's actually a lot of benefit to strengthening with EDS. So the things that we do know with the benefits to strengthening with EDS, we know that strong muscles can help stabilize the joints just to be able to get through your everyday activities. And strong muscles come from strengthening, and you need these to help stabilize the joints if you are hypermobile and the ligaments and the structures are too elastic. You need the muscles as a secondary support. You need a basis of strength before you can consider any sport or recreational activity. So if you're thinking about doing yoga, if you're thinking about running, if you're thinking about doing dance or any sport really that's out there, you absolutely need a base of strength before you can consider any of those sports. Strengthening programs for those with EDS can improve tendon tensile strength, which assists with stability, and this is science. So this comes from a study, and they looked at the tendon strength, the integrity of the tendon before and after strengthening programs in those with EDS, and they found that the tendon actually improved in its integrity after the strengthening program. So tendons can help reinforce joints. They do attach to the bone, from muscle to bone, and it can also assist in stability. So that's really important to know. Also, in the literature, strengthening programs in those with hypermobile EDS can decrease overall widespread chronic pain. There is, of course, that introductory curve that you have to get through if you haven't been doing a strengthening program where, things aren't going to feel that great. Hopefully not too much of a flare-up of pain, but you do have to break through a cycle where your body isn't used to doing things. And as you slowly start to progress into a strengthening program and keep it up regularly, they are seeing that it does reduce chronic pain. And another thing from the literature, strengthening programs performed in those with EDS, they have shown to improve overall quality of life. So although, not necessarily anything measurable in terms of strength or joint mobility, but overall just feeling of wellness is improved with strengthening programs.
Knowing the fundamentals before you start. Now I have to look over at this picture and just facepalm along with the emoticon. I mean, the lordosis in the lower back, it's even increased holding this beach plank position. The woman on the right looks like she's doing a bit better, a bit hollowed out through the trunk, through the core. But man, we see this all the time in magazines, 15-minute plank challenges. You're not doing the musculature that you're trying to work on any good here. The fundamentals that we want to cover start with systemic stability. Now, exercise is stressful on the body, and that word has a bit of a bad rap. Stress is good for the body. You put it under stress, it figures out how to attenuate for it, and you can build on it from there. But if your system is not ready to handle the stress of working out, you can set yourself back even further. So we need to have some baseline of stability within the system. Can you handle the stress from exercise? Definitely want to have proper form in everything you do. This is paramount. More so than going up in weight, than going up in repetition, or how often you're doing it, proper form is so key. We'll stress that throughout this. You want to work within your limits. Do you know what your tells are? Do you have a right upper trap that gets achy when your shoulders and back are done? Do you have a hamstring, like a high hamstring right below your tush, that gets flared up when you've done a lot of walking? We need to know these limits so that we can revert back to form and see where things are breaking down. We need to have realistic goals. And this is tough for every individual, EDS or not, that I work with, because having realistic goals involves you projecting way out into the future. Can you forecast not what you can just do in a month, but in a year and in 10 years? Can you really visualize what your capacity and where your true potential is? And lastly, we don't work through joint pain. We don't work through pain. And here's where it gets a little fuzzy with figuring out what's acute pain, what's from working out, what's muscle burn. That's why Dr. Patty put joint pain in here. So anything painful in the joint, we don't want to push through it. We want to go back, look at point 2. We want to make sure we have proper form. What does your exercise program look like? Are you at home with your own equipment? Do you have a mirror to be able to watch your form? We find that visual feedback is pretty pivotal in the learning process, as a lot of people do well seeing themselves perform the motion and not just feeling it. Are you going to a gym? If so, will you be too competitive with yourself if you're surrounded by others? My self-critical people out there that are very self-reflective and pretty hard on themselves at times, are you going to push things too quickly knowing that people might be watching you? On the other hand, are you going to a very high energy gym where you might find yourself being too competitive with the other members? In a new place with new equipment, do you know how to properly set up and use it? Free weights. We definitely need good form with, and it goes to say for everything, right? But when using free weights, it's real easy to get caught up in just letting your body move through whatever motion has the least resistance. So take pressing overhead, for example. If I don't have my abdominal wall braced, my shoulder blades depressed, my chest in a good position, my feet perhaps staggered, and I go to press up overhead as I'm standing, I could just easily let my back sag, let my shoulders dump, let my head jut forward, and still get the weight overhead, but not necessarily with the form I'm looking to have. Using the machines, we know that there are 1,000, more than 1,000, right? But so many different body types, and each exercise machine in a gym has a variety of moving parts. Do you know why you might need to move the seat up versus the backrest up? We need to understand how and why we're using the exercise equipment and how to do so properly. Talking about open chain versus closed chain activities, we use a little bit of both. I'll give you an example with the hamstrings, for example, the muscles on the back of the thigh. I might have a seat, or you know what, I'll lie down on my stomach with an ankle weight, and I'll flex my knee. So I'll curl my leg up using the muscle on the back of my thigh, using my hamstring, and I'll do a prone hamstring curl with an ankle weight, open chain. You don't get a lot of feedback with what's going on in that end of your leg there because your foot's not in contact with anything. It's hard for the brain to perceive where it's steering it in space. Versus, same muscle group, will go hamstrings, the tush. We'll put you in a closed chain environment, have you lie on your back with your knees bent in a double leg bent knee yoga bridge, where you bridge up in the air through your heels. Now it's closed chain. That ground's not moving anywhere. You pick up a lot of neural data, a lot of feedback from having your feet on something stable. So what are you going to use? More open chain activities, closed chain activities? It depends on what we're looking to get out of it and why.
Well, what are you supposed to strengthen if you do start a program? I can cheat and just say everything because you really do. If you're hypermobile, then chances are you probably need full body strengthening. But more specifically, things to focus on is your core. You know, we have this saying that distal mobility comes from proximal stability. So in order to be able to use your your hands, your arms, your legs efficiently, you have to have a strong core to support the whole body. So your core is really super important, big muscles that really hold you together. And then next, you need to look at your weaknesses. What are your particular weaknesses as an individual? Do you have weak hips? Do you have weak shoulders? Do you have weak hands? What are your weaknesses? And those are things that you need to really focus on while they are causing an obvious problem for you. And then another one is your previous injuries. So this isn't something that you necessarily have to always do ankle rehab for the rest of your life, but if your previous injuries are currently causing you issues, you absolutely have to pay attention to them. And then tuck those exercises away that seem to help for when you need them again eventually. But hopefully in the in between, if when the injury is flared up and you have a good period of time, hopefully you are doing something just to stay active and healthy so that you don't have to do a specific strengthening program, but you can maybe be involved in a sport or activities that take up the place of those exercises. So more fun stuff rather than having to focus on specific exercises all the time. But when you do need them, you do need to pull out your specific exercises to be able to address your injuries that you're dealing with. And then, like I had said, if you want to do any sports or recreational activities or whatever your goals might be, you need to strengthen those muscles that are involved and are going to help you support whatever you decide to do. So it's really important to understand a little bit of anatomy, which we are going to kind of go over a little bit of anatomy today. But you really need to know, whether you decide to work with a professional or figure it out on your own, what things do you need to work on in order to support your activity that you decide to do. And how often are you doing your strengthening program? This slide might actually seem to be the opposite of what you would think, but we're going to explain it now. It really depends on your current level of strength and fitness. If you're actually more active with less pain and you've been doing something for a while and you're doing some sports or activity, then you probably need a less frequent program and you can probably tolerate more complexity in your workout. So, bigger weightlifting, bigger motions, stuff that involves multiple joints. You're usually trained up to this point where your body can handle this, that it's responsive and it's used to this. If you're currently less active and you're dealing with higher levels of pain, then you need to think consistency over quantity. You need to think of doing something every single day, especially if I've given people an exercise and they can only do 2 or 3 repetitions. And these are the people that need to be doing something every single day. And I don't care if it's 2 repetitions, because that person in a month or 2 is eventually at 10 and it feels better. And that's exactly what we're looking for, the consistency, so that the body understands, oh, you want me to do something, all right, I guess I'll work with you. Let's go ahead and I'll give you 1 more today. It'll eventually start to feel better, hopefully. And again, these are decisions that you need to try to figure out with your physical therapist or a personal trainer as to where you're starting, especially if you're at this higher level of pain. It's a really good idea to talk to somebody about where you should be starting, and then your progression, although I really stress slow is extremely important and consistency is important. And the less exercises, the better. If you're really involved and you can't tolerate a lot, then maybe you're working on 2 exercises, 1 for the hip, 1 for the shoulder, until that gets better. So yes, it's a very, very slow recovery, but that's what we're looking for, because the body is dealing with so much. We don't want to introduce too much to cause a flare-up of something else systemic. We want things to go a lot more smoothly. And then resistance also. Don't worry about resistance. We usually use body weight or even what we call gravity assisted, so that you're not lifting too much too soon. And we'll go through some of those easier ones in a little bit, joint by joint. So eventually, when you're under control and your pain is a little bit more under control, you're starting to get back to daily activities, you're feeling better, you're thinking about maybe doing a sport, 2 to 3 times a week is a good goal. And this really is per body part. So if you want to do like a combination, core, shoulders, hips, like kind of an overall body program and you're going to spend 30 minutes doing that, then sure, 2 to 3 times a week is fine. If you want to spread that out because you don't feel like doing 30 minutes at a time, then again, you're looking at, okay, well, 2 times a week for the shoulder, maybe 10 minutes here and there, 2 times a week for my hips. But you want to try to make sure that you're getting in all those body parts that we talked about, whether it's a previous injury, weaknesses that you have, or you're trying to support a sport that you're doing. So eventually 2 to 3 times a week is a goal that we're looking for whatever body part we're interested in. And we touched on daily commitment already when we talked about starting at a lower level of activity and higher pain levels. So if you're starting at this lower level of overall health and a lower level of activity, being able to be consistent and doing daily activity can help break you out of many cycles. I tell a lot of the people I work with, well, everybody that's stuck in a pain cycle or a fatigue cycle or whatever cycle systemically you might be caught in, that if you want to break that cycle, you have to be consistent. Your cycle's consistent. You need to be consistent in the proactive things that you're doing to break it up, and you can't take a day off. So that's why we say, if you're looking at the exercises, if you're doing 1 or 2 exercises, you should really be able to keep those up every single day. And we've talked in our other lecture, if there is a day that you cannot do anything at all physical and you are insisting that you cannot, then that's fine. Go do something proactive, buy your spoons back, do something that you know is going to make you feel better. Work on your nutrition that day, work on your sleep that day, go out for a massage, get some fresh air, but buy your spoons back then. It's you've got to find something to be able to balance what you're dealing with. Now, if you're starting as low as 5 minutes of strengthening per day, that can be fantastic when you're just starting out. And again, I've given people 2 exercises to do, and they've made progression over the next few weeks. And it does not have to be any more than that to be able to make gains, because remember in the beginning, if you're tolerating only 5 minutes, your body is probably dealing with a lot systemically. You need to first convince it that consistently you're going to be doing something and that it needs to start working with you. And that's all that we're trying to do in the beginning, so that we convince it to start working with us. And then we can start pushing the boundaries a little bit as we start to feel better, and that consistency feels easier, and those 2 or 3 repetitions feel a lot easier, and you're able to work your way into, about 10 minutes or so, or 10 repetitions of the exercise that you were given. Eventually, daily strengthening, when you get to the point of about 15 minutes or so, that's enough daily strengthening. That's a lot, especially if you're working every single day on something. And then at that point, you might want to look at doing stuff 2 to 3 times a week and starting to add the minutes up there. So doing 18 minutes 2 to 3 times a week, focusing on different things. But it's when you're working on the daily strengthening, you don't want to do too much all the time, unless you're into bodybuilding, and then that is absolutely fine because you're focusing and that's your sport, or you're dealing with an injury, or you do have a lot going on. But you don't necessarily have to do any more than 15 minutes a day. You can switch to that 2 to 3 times a week. And I say that for those that are, we're all super busy, we're all stressed out, we all have a lot to deal with, especially with other health problems that we're dealing with. So when you tell somebody that daily strengthening is important, it gets a little bit anxious-ridden, nervous, don't know if you can keep it up, but knowing that it's okay, it doesn't have to be that long, 10 minutes, 15 minutes max a day, and then you need to start breaking it up a little bit further throughout the week. I hear this quote a lot, and it's important to know that pain comes in many shapes and forms, and it's more of a signal from the body and isn't necessarily an alarm going off for a lot of us. But I hear from a lot of people, it hurts, I can't do it. And I'm talking even extremely, extremely, extremely minimal exercises. And if that's the case, then we might be thinking that it's more of a neurological-based pain that you're dealing with rather than an inflammatory pain for some. But that's what I tend to see when I work with people. And we really need to analyze, well, what type of hurt are we talking about? When I ask you to do 1 repetition, what type of hurt is it? Is it sore? Is it similar to what you've been feeling? Is it the same stuff that you deal with each day? Or are we getting a sharp stabbing pain that you feel like you can't continue this exercise? Does that pain get better after a few exercises? If it's muscular, sometimes it does. And I would never ask anybody to push through anything, but can you give me 3? Can we see how that goes? Or can you do 1 and maybe we do it 2 or 3 times a day just to evaluate and see if there's a better time of the day? So, what type of hurt are you dealing with? It's really important to become in tune with your body and start to understand that there's certain pain that's currently there that you're dealing with, that if you potentially feel that pain doing an exercise, you're not going to cause more inflammation. But there is most certainly a type of pain that you can start feeling that is an indicator that your inflammation is building up and you should probably stop doing it. So again, you have to be really in tune with your body or really work with somebody to figure out, is this the right thing for me to be doing? Should I do something else? Should I do less? Should I not push as far? So this is really, really, really difficult to be able to distinguish what type of pain you're feeling. But it's something to experiment with safely, and again, not pushing through anything. Like I've said before, I've started with 2 repetitions and worked to build up to 3 when those feel better. And a couple weeks later, this patient was on to 5, and a couple weeks after that, now they're doing 10. And it might sound silly, but those 10 repetitions was then translating into increased walking time throughout the day because we were working on the hips. And it was so slow, and we made sure, you do not try to do 5. I don't care if it says 20 on the paper. We're going to work up towards that, and we're going to do it really, really slow until 2 repetitions feels easy. And then we're going to go up to 3. And then we're going to go up to 4. But it's such a slow progression that you need to be able to do so that you're working on, again, convincing the muscles, this is what I want you to do, but I don't want you to get mad at me. Can you exercise in a pain-free range? Are you rotating the knee out too far? Are you lifting the leg too high? Are you pushing the shoulder back too far? Can we do it in a smaller range and still get the muscle activation without the pain? So if you decrease the amount of movement during the exercise, you can still get a muscle contraction and maybe not the pain with it. So again, this you need to be monitored during, or in a mirror if you know what good form looks like. And then of course, how's your form? Are you doing it correctly? Do you need somebody to watch your form to make sure that you're not putting too much strain on the joints in certain positions, because that can most certainly occur for us.
Upper limits. People want to know them. How far can I realistically go with strength? Well, we need to start with function first. Before you're thinking about upping the weight, moving up there like this gentleman in the picture here, we gotta have baseline function. We have to have function, we have to have form. Now, anecdotally, with the people that we've worked with, these are the power lifters that have been going at it for quite a number of years, it's reported that there's a bit of a plateau, whereas their workout buddies might continue to progress, albeit in smaller, seemingly plateauing increments. They're still progressing and they feel like they've hit a wall. Now, one study in the EDS population stated that those with EDS had the same muscle mass as the control group, yet they had reduced strength endurance, and functional capacity. So again, not a lot of data out there. The point isn't to limit yourself by thinking, I'm not going to be as strong as the strongest person on the planet, right? We don't want to think like that. You want to see how far you can go with it, and then we'll address something like a plateau that comes up when it does by checking form, seeing if we can optimize positioning any better, right? So don't limit yourself. Understand, though, that you can make a lot of gains by working yourself through a program. So let's get down into the heart of the content on this presentation here. We're going to cover the shoulders and be big on scapular stability. That shoulder blade is really part of your shoulder, right? It's where your arm bone articulates with your body. That creates the shoulder joint. People think of their shoulder, though, as just this thing next to their neck, right, that moves a whole bunch. But that shoulder blade that goes all the way down your back into your thoracic spine, it plays a huge role in dictating the health of your shoulder and its functional capacity. We'll talk about the core in 3 different ways: through the abdominals, through the hips, largely about gluteus maximus and gluteus medius, and through the core via the thoracic spine. Now, look back up at the shoulders for a moment. The health and mobility, and a lot of zebras out there lack thoracic mobility that we'll cover. The thoracic mobility and shoulder health, they're linked really closely together because they work right next door to each other. We'll talk about postural muscles around there and down into the legs, the quads, hamstrings, the combination of the gastrocnemius and the soleus, so that gastroc-soleus combo, and then balance. Balance, yes, you're reading that correctly. Very important. So as I mentioned before with the shoulders, our focus should be on scapular strength. Our recommendations is that we're heavy on the pulling motions and weight-bearing exercise to work on that closed chain loop activity that I mentioned earlier, if it's tolerated through those wrists and through the hands, of course. Things we want to watch out for: reaching the hands behind your body line. If you're confused about what that means, do this right now or imagine it. Walk up to a wall, turn around so your tush is on the wall, you're facing away, and have your heels on the wall. Your heels are touching the wall, your tush is on the wall, your head is on the wall. Have your arms down by your side and put your arms against the wall. Those arms are now in line with your body line. If you were to be able to move the wall and you could push them through the drywall, they'd be behind your body line. So what we suggest doing is pulling just to the body line. Focusing on initiating the movement from the shoulder blades first. If we can create stability, we'll get better mobility. And then in weight bearing, don't let the chest collapse to the floor. We want to stay active. One thing that I tell people is imagine that there's a nose on your chest. Say you're in a push-up position and there's something stinky on the floor and you want to get your nose away from the floor as best as possible. Moving into some shoulder content here. Some very common exercises that we use are rows, both with bent and like a shoulder extension with straight elbows. A simultaneous external rotation, definitely through a pain-free range though. A prone, so on your tummy, I, T, and Y. And then a quadruped, so on hands and knees, rocking, making sure we watch for elbow hyperextension, and then progressing into a lift with the arm as capable. I should note that these exercises, while they look pretty straightforward, taken some of the strongest people through them and they are quite humbling. So have that as a heads up before you dive in. Alright, so start on the left here. Dr. Patty has pulled her hands behind the line of the body. Remember my example of getting up on a wall? See, those hands would be punched through the drywall? Alright, so we want to stop at that body line. Moving over to the next picture, another no. Don't let your elbows pull behind your body. If you look at her shoulder, her left shoulder, so we're on the second picture, as soon as you pull your elbows back, if you're not perfectly stable everywhere else and open enough through the chest, you'll dump your shoulders forward. We see that happen all the time. You're trying to do good, and you end up doing yourself a bit more harm. The picture in the very center, she's trying to get that motion so hard that she's now leaning forward. She's flexed at the waist. She's also pulled past that body line. So don't think that more is better, right? Don't just try to pull that band as far back as you can. Keep the form. Fourth picture, yes. Set the shoulder blades first. Imagine an orange between your two shoulder blades, and before you do anything, you squeeze the shoulder blades together. Don't shrug them up. Squeeze them back, like you're squeezing the juice out of that orange. Then bring the elbows to the side. It should look like a two-step movement of pulling back, boom, you're stable, now create the movement, return, unload. Boom, create the stability, pull the elbows back just to your side, and then return. And yes, so that's the bent elbow in that fourth picture. We have the straight elbows, pure shoulder extension here. That chest is in a good position, Head is neutral. Shoulder blades were boom, squeezed back first, and then hands pulled by the side. Moving into the quadruped position for the shoulders. So on hands and knees, that closed chain activity. A lot of good feedback. That ground's not moving anywhere. We like it. Now, for any of these positions, you can use a fist position off the first and second knuckles, or grab a hand weight that you can then drive the heel of your palm through if you can't tolerate being in that extended wrist position. Now start on the left here. In this picture, Dr. Patty demonstrates shoulders that are not doing a good enough job supporting. That chest is falling towards the floor, the lower back is arching. She's kind of posted up on her slightly hyperextended elbows. Now moving to the middle, Dr. Patty will be the first to tell you she's been working long and hard on her thoracic spine mobility. So you'll see it a bit arched. We're looking for it to be flatter if possible. But what she's doing really well here is having slightly bent elbows, having a chest that's actively pressing away from the floor. And if you can tolerate this without an issue, you can slide to the picture on the right where we're going to this one arm lift. So you're supported on the left, you're squeezing those right scapular muscles as you lift with that thumb up. We do like thumb up with this. It creates a bigger external rotation moment at the shoulder. You'll find a bit more stability. But just lifting up off the ground, height is not important as you do this, and then returning and alternating. So we have a couple open chain exercises. These are very difficult to do. You want to be pretty picky and understand that there's not a ton of movement to be had with this. If we keep things honest and positioning is good, you're not going to be lifting your arm a foot up in the air. Start on this pronai here. You'll see what I mean. Head is neutral, so put your hand there or a little towel roll. Squeeze the shoulder blade into the backbone first with your arm down by your side, and then lift off just a bit. All too frequently, though, we see people just go straight for the lift off. That shoulder dumps forward into the ground, and they think they're doing a great job because that fist might be a foot up in the air, but they haven't created that stability first. Remember, we want scapular stabilization first. So boom, shoulder blade gets squeezed back, then arm gets lifted up. If that's tolerable, you can move to a T. Squeeze the arms out to the side so we're abducted, abducted 90 degrees from the side body. Squeezing the shoulder blade back and then lifting the arm up. You don't have to be off the ledge here. You're only going to get an inch or two up off the ground anyways. You could be on a flat ground. And if thumb up position bothers you, you could do it with your palm down as well. Moving on to the Y. All right, you'll notice that Dr. Patty's head is turned here. We turn the head to the opposite direction. This gets a bit nerdy and we'll go with it here. We turn the head to the opposite direction because it shuts off your upper trap's ability to help out. And if that doesn't make sense, try one with your head down first, a one-armed prone Y, and lift your arm up like you're doing half of the YMCA. And as you lift it up, you'll be able to lift it a little bit. Return back to the ground, and now do one with your head in the opposite direction. That upper trap's not able to kick in. That lower trap is really forced to kind of tug down and depress that shoulder blade to find stability. And then lastly, on the right, we have simultaneous external rotation. Remember, I want you to be very picky to make sure you're doing this in a pain-free range. Same thing though, shoulder blades engaged first by squeezing them back, right? Shoulder blades down so you're not shrugging up near your ears. So boom, squeeze back, shoulders down, and then externally rotate. Don't worry about going too far. We just want to create some tension to be able to return back after.
Let's talk about the core, the abdominals, the back muscles, everything around this area. And we stressed earlier that the core is something that you should really always focus on because it's stabilizing muscles. You need a nice stable core to be able to use your arms and legs and neck and head. So having a stable core is what's really going to help us in being able to use everything else. Your focus should be on the stable core, controlling movement around it. And I really stress function to people. You see some people doing some exercises in the gym, and we have to remember, the next bullet point, avoid extreme end ranges of spinal movement. So that big flexion or bending at the spine, or extension where you're pulling the spine up and back into almost a back bend. Those aren't really functional things that we do throughout the day. We do a lot of lifting, hopefully from a lot of the legs with stabilizing the core. We do twisting and turning and movement in those directions, but we don't really do a lot of sit-ups throughout the day. We don't do a lot of back bends, like you see these people that are lying face down, hinged at the hips over a table and doing these huge lifts of their, bending and hyperextending at the back, trying to lift themselves up. And that's not what those muscles are for. Those muscles are really postural muscles and meant to stabilize us, not really to lift us in those type of motions. There are some people out there that can tolerate doing that, but if you are dealing with other issues, that's not what you should be thinking as a start. Your focus should be on keeping the core stable and then using motion of the limbs to help activate the core more. When you start doing this, so if you're lying on your back, we'll show some pictures in a bit, and you're doing some of these exercises where you're moving the arms or the legs, if you start getting that hip clunking, which is pretty common, EDS or not, in the front of the hip or deep into the hip, when you begin to add that limb movement in, you have to take it to the point where you start to feel the pressure and not the clunk, because that's just that tendon sliding over the bone, and you're going to continue to irritate it if you push through it. So avoid the hip clunking while you're doing any of these exercises. Our recommendations overall for things to work on is definitely the transverse abdominis. This muscle is like a sling for the whole core system. We really need it to be able to stabilize pretty much everything in the body. You can start with just general activation of this, and then progressing to adding those limb movements that we were talking about, whether it's legs or arms. TheraBand work can be added in, so rotations with the band, resistance with the band, and then planks only if the shoulders can tolerate it and your form is correct. I can't stress this enough. I know what a good plank looks like, and I personally can only do them if I have a mirror as feedback or somebody working with me, because my back is always in a bit too arched of a position right through my mid-spine. So even I, who know how to cue somebody to do this, I still need feedback myself. So please, having mirrors around and really looking and checking in with your posture is really important, and avoid planks if you're not 100% sure that you're doing them correctly. Some of the common exercises that we talk about, these are always stuff that you can Google search, but we are going to go over some of them coming up. But just as an example of things that we do talk about doing with our clients, or a slower progression with anybody who might need it, is that transverse abdominis progression. And we'll go over a few of those, but that's just lying on your back, stimulating the transverse abdominis, getting it to contract and react is what we really want it to do, because when we need to call on it to use it, we need it to respond. So this is where we start. We start by just working that neuromuscular input of trying to get it to fire before we start adding other things on top of it. And this is actually, for a lot of people, a lot more difficult to do than it actually sounds. Just pulling the belly button up and into the backbone is actually extremely difficult for a lot of people to do without activating different muscles. The multifidus walk is just a lateral or a side step that we do, holding the band in the hands, which activates all the little spinal muscles and helps stabilize. I also like it because it's a full body one too, so you're going to end up using your arms and your legs as you do this exercise as well. And you can start with a really low resistance on the band. A rotation with a band, I highly, highly, highly recommend doing this one seated or on an exercise ball first, because there are a lot of people that have difficulty doing this without rotating the knees. So we'll show a picture of that in a little bit as well. And then planks we talked about. Planks are great, whole body workout. However, it's very, very common to do them incorrectly. So please make sure that you have some sort of feedback, whether it's the mirror that we talked about or having somebody watch you in your form and be able to correct you appropriately. We've given you a few examples here of some of those abdominal exercises that we were talking about. That transverse abdominis, or TA activation as we call it, is really the start of any abdominal exercise that you do. We tend to lose that mind-muscle connection from especially to this particular muscle, and you really need this muscle to be engaged with pretty much anything that you do, especially with core work, and with any bigger work. You need this with running, you need this with twisting and turning. So this is a really important stabilizing muscle, so making sure that you have this in your workout routine, I would say for just about anybody, to make sure that you can do this and that your body does respond when you ask it to do this exercise, because you need to be able to squeeze your lower abdominal muscles by pulling your belly button up and in towards your spine without using any other muscles. So you're not using your hips, you're not pushing into your feet, you're not lifting your head, and you're not sucking in or holding your breath. So this is just those lower abdominal muscles engaging. The first picture is just a relaxed position. The second one, you can see barely really any movement there except that belly button being pulled in towards the spine. And then once you get that down, you can do, at least 10, 15 in a row, and it feels okay, and you're not getting lightheaded or dizzy from holding your breath. You can then add the limbs as we were talking about. So the next two are just some different leg variations. If you were to hold this TA activation and held the belly button in and then lifted the knee into a march position, slowly up and slowly down, making sure that you didn't lose that belly button to your backbone position, especially as you were lowering the feet. And that last one there on the right is that TA activation with what we call a bent knee fallout. So one knee at a time is going to slowly rotate out to the side. Again, you're not losing that belly button into your backbone position. The other hip is not starting to pop up. Everything stays fully contracted throughout this exercise. So just a few different ways to do this exercise. Super advanced, you can add in arms with this as well, but I definitely recommend starting with the legs so that you can really engage those lower abdominal muscles. A few more pictures to look at. The first one, that multifidus walkout, where you're taking a side step. So if you're looking at this picture, that left foot, which looks like our right because we're mirroring. So the left foot is walking out to the side away from the resistance of the band. And you've got to keep those hands right in front of the belly button. It's going to want to pull your hands back towards where the band is coming from, but you've got to keep everything straight and in one line. The shoulders stay forward, the toes stay forward, a little bend in the knees so that you can really activate those hips as you're walking through. So this is a really good one, taking 2 or 3 steps out to the side and then back in. And that same TA activation, that belly button into your backbone throughout this exercise as well, making sure that your shoulders aren't rounded forward and you have really good posture. This is a really good one to do. Again, full body exercise, and that is a very, very strong band that's in that picture. Different companies have different thicknesses of bands, but I would definitely recommend starting out with a much lighter band. The plank exercises we talked about, you really have to be super duper strong. You can even see in the middle picture here from the knees, there's a little bit too much of a bend in that thoracic spine there. Like I said, it's very hard for me to control that part of my spine. And that's even with cueing from somebody. So these two pictures actually took a very long time to take because I just don't have that plank form. And planks aren't usually something I do in this position with my workouts because of that, because it's not safe for me. However, if you want to do that, I put these in here really to show you that you have to be able to do them completely right. Not everybody, EDS or not, should be doing planks. It really takes a lot of strength, a lot of effort, and a lot of control of the body, and really a really good sense of feedback as to where your body is in space. And again, having that mirror or a person to give you feedback is really helpful. What you want to make sure too, whether you're doing this exercise from your knees or from your toes, is that those elbows are underneath your shoulders. They're not too far out in front, out to the side. You really want to stack those joints so elbows go right underneath the shoulders on this. And then you want to make sure that you don't have a curve in your lower back. That's super important. So again, that's that belly button into your backbone, that TA activation, so you don't get dumping in the lower spine where the belly dumps towards the floor. So again, more so, I put these in really to to almost discourage people from thinking about using this as a beginner exercise, and to really encourage everybody to make sure that you have a mirror, or even put your phone on selfie mode if you can set that up, so that you can see yourself, so that you can really get good feedback as to what your body is doing and if you can tolerate this exercise. The last few here, again, these are planks really to show you form and technique, because I know that a lot of people do them. And I think a lot of people need a little refresher on form and alignment. But it is something that's easy enough to do. There are so many other abdominal exercises out there. But again, we throw these in because it's a stable core. You don't have a whole lot moving, and you have multiple body parts working at the same time, if you can tolerate it. If not, then you go back to the ones on your back, or that multifidus walk is a really good one, or the trunk rotation, which we'll get to in a little bit. If you're doing a side plank from your knees, this picture on the left here, actually the elbow should be slid underneath the shoulder a little bit more. That's a little wide, still okay, but you really want to make sure that everything is stacked up and you're lifting your hips up towards the ceiling. And you can see from the side view in the middle there that the body is really in one line. You've got your shoulder in line with your hips, in line with your knees. So what happens a lot is the butt starts to poke back too far, and then you end up with a little bit of dumping through the hips. But if you maintain everything in one solid line all the way down, then you'll get much better activation from your core. And again, if you feel like you can tolerate doing a side plank from your feet, you want the same alignment cues. You really want to make sure that the elbow is right underneath that shoulder, that you're really pushing up and through the floor, so that that bottom shoulder is lifted up and away from the elbow. You want to have that separation between your body and the floor, so that you're not collapsing and dumping into or twisting on the stable elbow that's on the ground. And you can put that top arm, a hand resting in front for a little bit extra support. But again, these are here to show you what alignment should look like and why it can be so tricky to perform. But the core can be done many different ways. Just a few little key pointers to show you guys on alignment here. The last few here, again, these are planks really to show you form and technique, because I know that a lot of people do them. And I think a lot of people need a little refresher on form and alignment. But it is something that's easy enough to do. There are so many other abdominal exercises out there. But again, we throw these in because it's a stable core. You don't have a whole lot moving, and you have multiple body parts working at the same time, if you can tolerate it. If not, then you go back to the ones on your back, or that multifidus walk is a really good one, or the trunk rotation, which we'll get to in a little bit. If you're doing a side plank from your knees, this picture on the left here, actually the elbow should be slid underneath the shoulder a little bit more. That's a little wide, still okay, but you really want to make sure that everything is stacked up and you're lifting your hips up towards the ceiling. And you can see from the side view in the middle there that the body is really in one line. You've got your shoulder in line with your hips, in line with your knees. So what happens a lot is the butt starts to poke back too far, and then you end up with a little bit of dumping through the hips. But if you maintain everything in one solid line all the way down, then you'll get much better activation from your core. And again, if you feel like you can tolerate doing a side plank from your feet, you want the same alignment cues. You really want to make sure that the elbow is right underneath that shoulder, that you're really pushing up and through the floor, so that that bottom shoulder is lifted up and away from the elbow. You want to have that separation between your body and the floor, so that you're not collapsing and dumping into or twisting on the stable elbow that's on the ground. And you can put that top arm, a hand resting in front for a little bit extra support. But again, these are here to show you what alignment should look like and why it can be so tricky to perform. But the core can be done many different ways. Just a few little key pointers to show you guys on alignment here.
Talking about the core, but now in the hips. The focus should be on the stabilizers, so big gluteus maximus and medius. Our recommendations: set repetition, build up before resistance increase. So be able to do these and do these well before you just go in for resistance. Remember that gravity is always present, so gravity is resistance and you'll be feeling it. We want to look at non-weight bearing before weight bearing exercises. So don't assume that just because you're standing up, it's air quotes better for you. You need to do what you need to do at the moment. We don't want clicking or clunking in the hips, so avoid that. If an exercise is producing that for you, back off of it. We'll see if we can scale off. And lastly, we want to avoid weight-bearing exercises if you can't stand on one leg, keeping your hips even for 10 seconds. A lot of people can balance for 10 seconds, but their hips are all over the place. We want you to show us that you're able to keep things level throughout the pelvis to tell us you can create stability in that stance leg. Common exercises that we use for approaching the core and the hips are clamshells, reverse clamshells, a gluteus medius diagonal leg raise, prone hip extension, avoiding the use of back muscles. That's really tricky. There are not many Americans that have a whole lot of true hip extension. A lot of them substitute with lower back extension. We can't have that happen. And then we want to progress into bridging after isometrics become easier. So let's get into them here. We have the clamshell, a pretty standard exercise that if you've been to PT, you've probably been given it for the hips. We're in side lying. You can support the head, however. But lying on the side, keeping the feet close, we want to lift that top knee off the bottom knee. Make this motion smooth and controlled. You want to try not to rock your weight back and forth on that bottom hip. So sometimes I'll take the right hand and put it on top of the right hip, which would what Dr. Patty would do in this picture if she needed to remind myself not to rotate back. But it's controlled lift up, control lower. The reverse clamshell. From the same position, legs are stacked now. Instead of picking the knees off each other, you're going to pick the top foot off the back knee. Now this is hip rotation that's happening here. Her knee's not moving into flexion or extension. It's staying put at about 90 degrees. But you want to pick up that top foot off the bottom and set it back down with control. And then here's prone hip extension on the right. It's really hard to be able to do. What you have to do first is engage that deep core, that transverse abdominis, so that you're not going into lumbar extension. With a bent knee, you'll try and squeeze the glute to create the motion. And that's about the best auditory cue that I can give you that I found really, really works. Instead of telling you to lift your leg, you'll squeeze your glute and you'll find that your leg will already start to move as you lift it off the ground. So think about getting that glute to grab a hold by activating it, not using your back. More hips. We have the gluteus medius lift here, this back diagonal lift. Lying on the side, we want to lift the top heel up and squeeze that glute as we pull that leg back and diagonal. It's difficult to do. It's not just a standard side lying leg lift. It's back and diagonal. You will need to brace through that transverse abdominis once again. Hollow out so that you don't go into lower back extension. You don't kick those muscles in as you go for this back diagonal raise. Of all the exercises in the body, I think one of the most important one is a standard double leg bridge. I can't tell you how much I love this exercise. I use it as a primer with my endurance athletes before hard workouts. I use it with people to help improve their capacity to stand up from a chair. There's nobody that it's not good for. Lying on the back with the knees bent, feet even, brace that transverse abdominis. Get a little bit of activation as you squeeze the glutes, lifting yourself up off the ground and lowering back down with control. Now, if you feel this in the lower back, here's a little trick for you. You can take the two arms that you have by your sides there and you can drive them down into the ground before you lift your tush. So it would be bent knees, transverse abdominis squeeze, just a gentle contraction. Drive both arms into the ground as if you're trying to push the ground away from you, and then squeeze through the glutes to lift your tush. You'll find a whole lot of activity. A more advanced bridge is this single leg bridge here. Starting out the exact same way, Dr. Patty here has gotten rid of her hands by her side. You could still drive down through both elbows. Thumbs up on the hips will show you if you're dropping a hip. So as you bridge up in the air, if you see in this case she has her right leg extended at the knee, if that right thumb is dropped down, she knows she's rotated. So this is teaching you to maintain stability where your hips would otherwise just want to be like, we'll just take the day off and drop down. So you could do this as a single leg bridge solely on its own, a handful of reps on each leg, or you could start it in a double leg bridge, kick your leg out, set it down, kick the other leg out, set it down, and come back down. There are so many different bridge variations. And then on the higher end here, another bridge variation is a single leg bridge with rotation. It'll begin as a single leg bridge, and after you're up and you're stable, you're happy with where you're at, you'll rotate the hip down of the leg you've kicked out towards the floor. You'll see on the picture on the right, that side profile picture, she's dropped that right hip, and then she'll pull herself back up so they're level before either repeating on the other side or going back down and then switching legs. So again, pelvis is level the whole time. That hip gets dropped intentionally, and you crank it back up there till it's level, and then go through your cycle again.
More continuation on the core. We're going to talk a little bit about the thoracic spine. And this can be approached from a number of different ways because of where the thoracic spine is located and what it's composed of. So we can talk about the shoulder blades because that plays a role in the thoracic spine strength. We can talk about even the core. We were talking about the abdominals before. Even the hip plays a role in the fascial system for the thoracic spine. So there's a number of different ways to address strength in the thoracic spine. The focus should be on that neutral. We were talking about that stable spine with movement over it, and also controlled rotational work. We do rotation through the thoracic spine and need to make sure that we have a strong, stable foundation before we do that rotational movement, which is what potentially can cause some rib dislocations if we don't have the strength to hold everything in. So our recommendations are definitely repetition and holds before you add resistance. These again are postural muscles, a lot in this area. So being able to work on more of that postural long-term static hold before you're adding really any weight to any exercise is really important. You want to avoid overusing your arms, your upper extremities, to gain more mobility with exercises. So if you're working on movement of the thoracic spine and the spine stops, you're not going to try to push it more with the shoulders. And we'll take a picture or take a look at a picture coming up that might explain that a bit more to you with a visual. But basically, if you're working on rotation, you don't want to guide with the hands, you want to guide with the chest. So you don't want to try to overstretch with the arms just to get more mobility from the spine. That you have to work on with the spine itself. And especially in the thoracic spine, with all of these tight little junctures in the ribs, you want to avoid pushing into pain. If something bothers you, then you're going to stop and you're going to work up until that point. Work to it, not through it, is what we tell a lot of people. Common exercises that we use for the thoracic spine, again, the previously mentioned shoulder and scapular work is really important. That ties into a lot of that thoracic spine. So very important not only for the postural strength that goes on there, but again for posture in general and positioning. If you start working the shoulders and scapular muscles, you'll get into a better postural position, which will potentially decrease the risk of injury in your thoracic spine. We talked about the multifidus walk before, that sidestepping with the band in the hands, and trunk rotation with a band is a really good one if you can control your posture with that one as well. Then we look at isolated thoracic spine movement. So if we're really talking about moving that thoracic spine, we can do some stuff in what we call a quadruped, so hands and knees position, with the hand behind the head and working on rotation. This is actually really difficult, especially if you have any restrictions, so it kind of turns into a little bit of a stretch and an exercise and can be really beneficial. I had mentioned before when looking at that trunk rotation, when we were talking about the core a while back, that this trunk rotation you potentially want to do seated. So this picture was taken while we were trying to beat a storm coming in, so we didn't have time to grab a chair or an exercise ball. So you can do it from this squat position that's shown on the left. This is really hard for a lot of people to do because not just EDS population, but a lot of even athletes have a really difficult time in keeping their lower body in one position and moving their upper body over the top of it and vice versa. So what tends to happen if we look at this picture here, and as we start to rotate the hands, the hips start to turn and the knees start to cave in, which is absolutely what we do not want to happen. So sitting on a chair or a therapy ball can really stabilize those hips so that you can really work on extending long through that thoracic, that mid-spine, creating good posture before you rotate out of that position. So again, the lower body has to stay fixed, and the only thing that's moving is leading from the chest, and the hands follow. And we talked about overcompensating with the arms. And this, if you can picture this, if that is as far as the thoracic spine is going to go, you try to get a little bit extra by pulling the arms over. And that's not what we're looking for. That's not where we want the exercise to happen. We want to work this thoracic spine. So when the thoracic spine stops, the arms stop, and they should be right in line with the shoulders there. The second picture is that isolated movement that we were talking about, and this one's actually really great. For this one, again, I don't usually have hands in that flat position for more than one or two exercises because of some sensitivity, so you can definitely do it in that fist position with the weight through the first two knuckles or holding onto a hand weight if you can use it as a gripping device, and then pushing up through the hand that's in contact with the floor or on the weight so that your chest isn't collapsing, and then using that elbow to guide and rotate the chest open. So this is really a chest opener. It's not an elbow pull. You're not trying to pull the arm back like we talk about that arm compensation. You're trying to open the chest and rotate that thoracic spine as far as you can. And for all the mobility that we tend to have with EDS, this area can actually be pretty restricted on a lot of people for many different reasons. It can get super complicated, and we can even talk about the GI system, but this area of the spine can really get locked down and difficult to move. So this is a really good exercise and mobility work, but you, especially with this one, you don't want to rotate through any pain. You want to take the exercise up to it and not through it. So you want to work with what you have that's still comfortable.
The legs. The focus should be on larger muscle groups and balance. Unless you're dealing with an injury, a freshly sprained ankle, let's let that heal up a bit before we dive into balance. Our recommendations? First and foremost, at the gym, we want you to avoid that leg extension machine. The amount of shear stress and force it places through your kneecap, through your patella, we're not the biggest fans of. There are more fundamental ways to work on the musculature around the knee. Now, hip exercises, and I should note foot exercises, which is why we've included balance, are so important to knee health. We often describe the knee as a crossroad to injury, meaning something's failed down at the foot or up at the hip, and it's caused a problem at the knee. Now, eccentric work may be helpful if tolerated, but you need a lot of control for that, and we'll come to that in just a bit. So avoiding the knee extension machine, avoid allowing the knee to wobble or cave in on any exercise. This is part of the control that you need. It's going to move around, and that's okay as long as you are trying to control it. What we don't want it to do is just dump in every single time. You want to avoid foot collapse and weight-bearing exercises. So the bone on the top of your arch, if you reach down and start touching your foot, touch your arch and then move up about an inch, that bone, that navicular, we don't want him or her to drop down to the ground. We want to be able to keep you in a pretty neutral tripod foot position that we'll talk about. And then avoid allowing the knee to pass forward over the toes without being able to drop back and put some weight through your tush as well. So we want to see a pretty equal distribution between weight in your heels and your forefoot so that we keep you in a good space. We see too often people not using their tush muscles, and instead of dropping their butt back just a little bit, the knees just drive straight forward. Common exercises we use are a squat or a leg press. And you can squat in so many different positions, narrow, wide, feet turned out, a bunch of different stances. We have small range straight leg raises. We have a hamstring curl machine versus a TheraBand or a weight, calf raises, and then some ankle specific exercises that might be needed for an injury. So let's start with this squat. Now, I told you earlier, Dr. Patty's been working hard on her thoracic extension mobility, so you'll see a little bit of restriction pick up here. As we start the squat, we want the tush drop back just a little bit and then the knees bent. We want those in unison. What you're trying to create, if you look down at Dr. Patty's foot and then track up so you're on her shin. So when you're on that tibia, imagine a line extending up to the sky. And then from the side of her hip up to her shoulder through her earlobe, her trunk, imagine a line through her trunk. And as best we can, we want those lines to intersect if we drew them up in space. So Dr. Patty's very close to being parallel here. Like I said, she gets a little bit more thoracic extension, she'll have it. But it's dropping tush back, letting knees bend a little bit, not worrying about depth, just getting muscles to activate. Small range squats are 100% acceptable, and they will definitely help you. Second picture shows her from the front view. Notice you can still see a little shadow under each foot in the arch, so the arch is still present. She's not collapsed in. If she was collapsed in, you'd see her knees starting to collapse in as well, but her knees, ankles, and hips are all lined up very well. She's got that smile too. On the right side, the two pictures demonstrate a straight leg raise. What we're trying to do is get the muscles around the knee to activate for us, and we can do first when we hit this up is get a little transverse abdominis activation, what we've used before. Then you want to flex the thigh, squeeze the muscles on that front of the thigh as hard as you can. Get good activation of this important muscle called your VMO, your vastus medialis obliquus on there. And then you just want to lift a couple inches off the ground. Maintain that position and then come back down. Now, if you have kneecap pain, anterior knee pain, patellofemoral pain syndrome, chondromalacia patella, maybe some IT band stuff too. One variation of this that we really like is that the whole setup is the same, but you're slightly rotated out at the foot, so your foot's turned out. That comes from your hip though, so you're in just a little bit of hip external rotation. Since gravity just works down on you, that drives that force a touch more through the VMO. Does it get more activation of it? It's hard to say, but it certainly will make you feel it a touch more and put some awareness into that. Moving down into the calves here and the hamstrings, the back of the legs, we have the double leg heel raise on the left. Now the thing we want to stress in this case is controlled movement, both up and down. You don't need to be standing on your own. If you have trouble with balance, you can have the chair or a wall there to help assist you as you lift yourself up in the air and control yourself back down. If you want a little bit more activity within the lower extremities, you can take a tennis ball and place it between your heels here, so we can get more posterior tibialis activation, some muscles within the foot, by squeezing that tennis ball at the same time. Now we can eventually progress this to either a single leg heel raise or take this same setup with the tennis ball here and just stick you over the edge of a step, where now your heels can drop down into this negative space, still with the ball there, and you get a larger range of motion. On the right side, we have a hamstring curl using a loop TheraBand. You can hold on to something or make this a balance exercise. You see Dr. Patty has her hands on her hips, ensuring that her pelvis is level. You want to keep the knee in the same position, thighs parallel to each other throughout this exercise as you curl that band up and come back down with control. Once again, that abdominal bracing is important anytime we're doing any type of movement, really.
I don't think balance is brought up enough. We threw it in here because it is such a huge component of dealing with injury, instability, any sort of imbalance that you might have. You need some balance work. You need to really stimulate the neuromuscular system So we're putting in a few slides for you guys just to talk a little bit about that, because it should be part of any sort of workout program for anybody, and especially those that are dealing with some orthopedic issues. You want to incorporate functional strength along with proprioception and functional stability. So this is basically being able to balance in that weight-bearing position, being able to support yourself on one leg without collapsing. This is really important. You need to be able to do this to walk without causing repetitive injury for yourself. You need to be able to balance on one leg. Everybody should work on this. Like I said, this isn't just the EDS population. We all tend to stop working on balance at some point. It seems like a silly part of an exercise to work on, but it's actually really important. And it's not just important because we need to keep up this neuromuscular control, but because we don't spend a lot of time with our shoes off, which is where we get a lot of that feedback of our intrinsic muscles in our feet, and just working on some balance work can actually help ward off some foot pain, hip issues in the future. So it does help with a number of different things for different people. Simple progression, just balancing on one leg. The really important part is having your hips even. They have to be even. If you have that hip collapse, you're actually not activating the muscles on that stance leg. Once you get that down and can hold it for a little bit, you can progress to a march with the other leg or adding in arm movement. Adding in rotation is very advanced, especially if you have what we call rotary instability of the knees. So that rotation movement that's super excessive. So if you go to turn your body, your foot can stay planted and it doesn't seem to bother you as the knee completely rotates out of socket. So if you have that, be very careful with this. It's actually a good thing to work on if you have the instability, but it's not something to stress. So it's very hard to stabilize with that one, but that can be a really good something to work towards in your balance progression. In the first picture on the left there, you have my little no picture. So if you can see, if this picture is mirrored, so if we're looking at my right, which looks like our left, you can see that that right hip is dropped. It's lower than the other side. The legs are touching. There's not a lot of support happening on that stance leg. It's not active. It's not supporting. It's just collapsed into the other side. And that doesn't count for balance. You're not activating the muscles. So if you look at the next one, this is, I guess you could call it a little bit of a march, but just making sure that the legs don't touch, that the hip is in line, if not slightly a little bit higher than that stance leg, so that you're really activating and squeezing the muscles on that stance leg. And again, you can do that TA activation, that belly button into your backbone. That really helps form that girdle on the bottom. That'll help support you as well. Single leg marching, where you, again, hold belly button into your backbone, stand up nice and tall through the spine, really try to lift through the stance leg, and then you can lift the knee up towards the ceiling. And regular march position, about 90 degrees with the hip, 90 degrees with the knee, and then back down. You can hold it, you can move it around a little bit. Again, you can play around with balance as long as it feels comfortable and you feel stable and you're working into these more advanced things. The single leg balance with arm movement, that second to last picture on the right, is just adding arm movement. Sometimes I have people hold a medicine ball and draw the alphabet in front of them. You can make circles, figure eights, V positions. So it's just something else to throw in there so that you don't get bored with the balance activities. And then this last one here on the right, that's that rotation I was talking about, but you can see the hips are still staying forward. They are pointing forward, knees are forward. It's just that upper body that's rotating away. And this is really hard for so many people to do. It's a really great exercise for a lot of people to work on, but it's not something to start off with. So this is one eventually that if you can work your way up to it, that would be awesome. But you really don't want to let that stance knee rotate. And this is really, really difficult to do, especially if you already have instability there. So this is potentially a goal to look forward to. Do not start with this one. But again, some of these examples are here to show you also what not to do because of what correct form does look like. So just be careful when you're doing some of these balance exercises and stay within your own limits.
Now, if Dr. Patty wants to get me fired up at a dinner party, she'll bring up feet or ankles because I love talking about them. And this is some really annoying activity you can do. to really work on arch support and longevity and function within your feet. Now, those of you that already do some intentional balance training by being barefoot during movement, dancers, yogis, martial artists, this stuff can really play in your favor and help increase your capacity to do everything, warding off foot pain and potential injuries. It's good for everybody. So right now, slide your shoes off and your socks. I don't want those socks to act as little cages for your toes. Keeping your foot flat on the ground, can you lift all your toes off the ground, just your toes? If you could do that, can you keep your smaller toes down and just lift your big toes up in the air? And then keeping your big toes down, can you lift only your lesser toes, only those 4 smaller toes? I know I got some of you. Let's move on to the next slide and we'll go over what we're talking about. So here's visual representation of the 3 things I just had you do. Lifting all the toes, keeping the balls of the feet down, not letting yourself rock out to the outside of your feet. Lifting just the big toes, and then lifting just the lesser toes. What we found is that in America especially, we put our kids in shoes and then you pretty much live in shoes. Unless you're at home, barefoot, or running around at the beach, there are not many times that we intentionally place our children or ourselves in a barefoot scenario. So the disassociation between these tendons, these extensor tendons and the intrinsics, the muscles within your feet, runs pretty rampant, and people lose control over the intricacies within their foot. If you hold your hands out in front of you and make wrist circles and wiggle your fingers around and make fists, you can do all those same movements down at the ankle, but we put our feet in shoes that just kind of get clunked around and take them off, and then the feet are like bricks. They lose that independence and movement. So these are a couple good long-term things to help you out. Working on a muscle that's involved in plantar flexion, your soleus, when your knees are bent. Here's that calf raise with the tennis ball, but from a seated position. So working on your soleus. This is great to do if you're doing some seated desk work for a while, and you know you have a history of ankle or calf, Achilles, plantar fascia issues. Put that ball between there and knock out some calf raises from that seated bent knee position. And then while you have the ball there, you might as well gift yourself with a little bit of plantar fascia rolling. Few people get truly tight plantar fascia. It's more of a result of overuse or misuse because of foot dysfunction. But there aren't many people that don't like a little foot rub. So it's not that your plantar fascia is tight. This is fascia. You're just working on the mobility to comfortably roll around on that ball.
You might have noticed that I didn't mention the hand and the wrist. I do have a lot to say on that subject, but this isn't necessarily the place for it because we're talking about strength and weightlifting, and that's not necessarily something that we're looking to bulk up strength-wise. We do have some more information on the hand and the wrist in terms of exercises in our preventing subluxations and dislocations lecture, just to talk about some reinforcement for stability. But the hand and the wrist tends to be used throughout workouts, especially if you're using weights, and we tend to overuse these throughout the day anyway. So they're very finicky muscles, especially if you have a job that requires the computer, or even if you have some atrophy in the arm and the tendons are a little bit weaker. Those either ends of the spectrum can lead to tendinitis if you start to do too much too soon. It's an area to focus on if you do have issues, but it's not necessarily a regular part of the workout routine because, again, you are getting gripping and movement with your workout routine. And there are specifics that you can hop over to the subluxation dislocation lecture to see why there are so many different problems that you can have, and it's really good to stop in with a specialist to talk about the hand and wrist so that things don't get worse over the years. Stability is sometimes difficult to reinforce through strengthening. The tendons, the levers, so we call them, are really long in the forearm into the hand and fingers. There's really no large muscles that cross over the joints in that area that add to stability. So again, there's some information on the other lecture, but we didn't put it in this one because we're not talking about necessarily strength and weightlifting, as a lot of people really think of. I do recommend that if you are having problems and you are doing a strength and weightlifting program, that braces and splints might be a really good idea if you're doing any sort of weight bearing, lifting with heavier weights, bar work, if you need a little bit extra stability. But again, if you need some more information on this, there is some information in our Preventing Subluxations Dislocations course.
When can I progress? Progression is always a key topic when talking about weightlifting and strengthening. You have to understand, though, that everyone will have a different starting spot, so everybody's going to progress differently. Some people are going to start at 3 repetitions of an exercise, while others will enter in at that 2 to 3 sets of 10. Starting at your own point is key, though, where you don't pass discomfort and into pain, and then reach fatigue or a flare-up. Now, that's an important point to realize if you're watching this with a fellow zebra and you're planning on being workout buddies. You're going to need to start at different spots more than likely. After beginning a program, everyone's progression is different. If you're completely new to this, you've never done this in your life, you're going to make a lot of gains in this neuromuscular connection. Initially, your brain's going to start rewiring a better connection pathway between squeeze your shoulder blades back, boom, you'll really strengthen that pure pattern. So you'll make a lot of pretty good gains pretty quickly. Whereas if you've done this in the past and you've fallen off a bit, or maybe you've just been wishy-washy and staying committed to it, you might not notice as much progression initially as somebody else. But progression in general can be impacted by overall health, systemic inflammation, flare-ups, or other general factors that contribute to health. Work, your work environment, stress, work stress, hydration, where you're at, nutrition, a whole host of things. All these contribute to your performance and therefore your progression. If you're unsure of what is needed to safely progress with the weight lifted or with the repetitions performed, you need to be monitored by a professional. Yes, you can start things out on your own, but there's no harm in asking for help.
One of the questions that we get asked very often is, should I be monitored by a physical therapist or a personal trainer for strength and weightlifting, even if it's something that you've done for a while? And the questions really are, do you want to or do you need to? And if either of those questions you get the answer of yes, then you do need to look for somebody. I tell people that I'm going to tell you yes if you have uncontrolled pain, uncontrolled systemic issues, and that really needs to be with somebody that understands the complexity of these hypermobility spectrum disorders and hypermobile EDS and Ehlers-Danlos, to understand, that fine line of pushing it too far on some days, so that they can really help control your systemic issues through movement as well, so that we don't get a flare-up. If you're new to strength training, if you don't have mirrors at home for feedback on form, then you really should, especially in the beginning, get yourself to a place where you can watch and see yourself and have that feedback, so that you know if your joints are caving in, if you have good form, using the right muscles. If you have a specific goal, it's really good to have somebody monitor you, again, to make sure that you're not doing too much too soon. And then getting into more advanced movements or activities, especially if you haven't done it in a while. If you really want to get back to some bigger stuff, like specifically a sport or something like that, then it's a good idea to have somebody guiding you to make sure that you're working on the correct muscle groups. The only reason why I would say no is if you haven't found a good match. And this could be either that good physical therapist or a personal trainer. And there are some very good personal trainers out there that are very form specific. So they're already knowledgeable about joints and joint movement, although possibly not these hypermobility disorders. But having somebody that is a real stickler on form can really be beneficial, and then you can help educate them along the way. There are some physical therapists out there that don't necessarily understand the complexity of the hypermobility spectrum disorders and the systemic inflammation and the flare-ups that can happen, and what happens when you push it a little bit too soon. Sometimes physical therapists, they really get into the groove of this is how progression should go, this is, the timeline. So you can have a physical therapist that's a little bit more focused on rehab in general rather than rehab for somebody that has EDS. So again, they could be super knowledgeable in anatomy and the body, but not necessarily specifically the best for you. So again, if you find that physical therapist that really understands, yes, you can stick with them, or a personal trainer that's very knowledgeable on form, then that's also a good match. But it's okay. It's kind of like I tell people, it's like going to the hairdresser. You really have to have a good vibe, and you have to walk out with a good haircut to make you go back. So you have to find that really good combination that works for you. And if you haven't found a good match, I hate to say it, but perhaps you wait a little bit. Or I talked to some people about Kevin Muldowney has a book out for a protocol, which is, it's very good to follow, but again, you don't have somebody that can monitor you and make adjustments. And I've heard from a lot of people that it was a little bit too much too soon, and that can happen. You can take that Muldowney book into your physical therapist or personal trainer to work with, so that you can modify. It is a good reference, but again, it's important to have somebody potentially guide you through it. But again, it's there for a reference. If you cannot find anybody that you're able to work with, having that as a reference is something good. These exercises, although we tell you it's not prescriptive, you shouldn't be using them unless you do have somebody monitoring you. There are plenty of references out there of just general light exercises that you can do. But again, it is important to find somebody that can potentially monitor you if possible. Again, if you haven't found a good match, then sometimes it's healthier to not continue that relationship with the personal trainer or the physical therapist until you do find one.
And again, like Dr. Patty mentioned, it's all about individualization. Even when putting together this presentation, we kind of struggled with what we wanted to show you, in that this is by no means, a specific plan for anybody. We just wanted to tease you and tell you that there are things that you can certainly do that are safe for you to do. With individualization, though, a big piece to take into account is motivation, like we talked about earlier, though. Do you need somebody pushing you? Do you need that accountability? That might help steer you towards this yes or no answer. What works or will work the best for you is the ultimate question that you need to answer in order to figure out if you need somebody monitoring you. And there we go, that's a wrap. I know this is a lot of content. When we did this live, we ran over by at least 15 or 20 minutes. There's so much to talk through. I appreciate you sticking around, though, and hearing us out. Remember that these are starting points. This is by no means an exercise prescription. You don't need to do all of these. All of these will not be for you. We're trying to tease you with a little bit of an idea of what you can do, and understand that as a zebra, you have a ton of capacity for movement. Weightlifting, strengthening, it's not your enemy. It's going to be your friend. We just need to approach it in the right way and progress as according. We are reachable via email. You'll see at the bottom at info@elevationwellness.co. Our website there is elevationwellness.co. And we're on social media under Elevation Wellness on Facebook, and on Instagram under the handle elevation_wellness_co. We look forward to working with you in the future. If you think we're a good match, we appreciate you taking the time and hope you have a great day.